Cerebral vascular accidents, or CVA, are also referred to as a stroke or brain attack. It is a decrease in blood flow or interruption of blood flow to a part of the brain not related to trauma. 1 in every 15 seconds, a person suffers a stroke in the United States. A fourth are fatal, and 30% survive with serious disability. It is a medical emergency. There is a sudden onset of neurological deficits, and symptoms and loss of brain functions are related to where the blood supply is interrupted. There is a reduction in cerebral blood flow, and there is tissue death. Strokes are the leading primary diagnosis for long-term care. It is often preventable if there is early intervention for hypertension and diabetes and other risk factors. Also, there is an ASAP need for rehabilitation immediately after the stroke in order to minimize the effects and to restore more function. Types of stroke. Ischemic. It is the most common, taking up about 80 to 90% of all strokes. Here, an emboli or thrombosis blocks the blood vessel. In thrombotic stroke, atherosclerosis is most commonly caused. An embolism, leading to an embolic stroke, is a blood clot or fatty plaque that has been sent to the circulation. Example, cardiogenic. A hemorrhagic stroke occurs when there is a spontaneous bleeding into the brain. It is more fatal as it is bigger and quicker damage. Typically, a rupture of a weak vessel wall or an aneurysm or arteriovenous malformation leads to the hemorrhagic stroke. Bleeding into the brain or meninges causes more loss of function and recovery is slower. Other causes of impaired blood flow to the brain include cerebral artery spasms, which can occur with cocaine and meth use. Also, cerebral artery spasms can occur with migraines. Other causes include lesions that can compress vessels and carotid artery stenosis. Go through each of these risk factors and review whether they are modifiable or not. We will review that in class. Also, as we look at this, ask as a nurse, how can we help prevent stroke in our patients? Screen for risk factors, teach, play an advocate, make sure they have the resources they need. Keep in mind, this also may need political interventions. The brain uses 20% of the body's cardiac output. The percentage of oxygen supply used by the brain is also 20%. And remember that glucose is needed to continuously fuel the brain. Well, how does the brain store glucose for further use? It doesn't. And the brain cannot resort to anaerobic metabolism. Primary cell death and permanent changes can occur within 3 to 10 minutes of blood flow loss. As cells are deprived of energy, mitochondrial breakdown and release of radicals eventually lead to cytotoxic edema. There is inflammation and immune response, which does further damage. Secondary cell death can ensue in 2 to 3 hours if blood flow is not restored. And the moral of the story is that with treatment, we can protect and restore blood flow to the penumbra. Remember, the penumbra is the areas around the stroke. We can also prevent secondary brain injury. Clinical manifestations are going to depend on the vessel being damaged or occluded and the extent of injury. It may be mild and transient, or it may result in major neurological deficits. It is sudden in onset, focal, and usually one-sided. Vessels that perfuse motor and sensory strip speech areas are commonly affected. Remember, the most people's broncas are on the left side. Evaluate whether the onset of neurological deficit is gradual versus sudden. Motor pathways cross at the junction of the medulla and spinal cord, so there is a contralateral effect. The acronym FAST can help us call 911 promptly. So if there's any changes with face, arm, speech, it's time to call. This slide shows you manifestations for a left-sided CVA, where there is left brain damage Clinical manifestations are going to impair right side function. A complete hemiparesis is weakness of the affected side, and it includes the face and the tongue. You guys can review this one, which is a right-sided CVA leading to left-sided manifestations. Diagnosis of stroke starts with recognition of signs and symptoms. So there needs to be public awareness. Diagnosis also begins with a complete history and physical exam. Time of onset is critical. Until proven otherwise, do not trust the patient's information regarding what they think they can and cannot do. Assess the patient for yourself. This doesn't mean being disrespectful, so ensure the patient's privacy and safety. A non-contrast CT scan identifies hemorrhage immediately. It identifies infarction in how many hours post-stroke? 6 to 8. What will an ischemic stroke initially look like on CT scan? Normal. Other diagnostics include an MRI. However, a CT is done first. A Doppler of the carotid arteries can help look for blockage. And an ECG and an echocardiogram can help rule out conditions that risk stroke, such as atrial fib. Now, goals are going to be to restore and support cerebral blood flow and to control and prevent further damage. Keep in mind that patients with cerebral dysfunction are very dependent on the ability of the nurse. Nurses caring for patients with cerebral or cerebral vascular disorders must be able to identify subtle changes in neurological function. The National Institute of Health Stroke Scale is a tool used to assess neurological outcome and degree of recovery, but is very useful in evaluating thrombolytic therapy candidacy. The Cincinnati Pre-Hospital Stroke Scale looks at facial droop, so ask the patient to smile. Arm drift, ask the patient to close their eyes and hold their arms out. There would be a lowering of the arm with simultaneous pronation of the hand. Evaluate the speech. Ask the patient to say, "Can't teach an old dog new tricks." So, this is a quick assessment. If one or two of these symptoms are positive, the person needs to get to the hospital. So call 911. If the time of onset is unknown, we're going to calculate when they were last seen awake. We have to include the time it took to get to the ER, to be seen, and to have the CT scan performed. We need to discuss immediate treatment for an acute stroke. Prompt treatment can save the cells in the penumbra. Remember, these are the area of cells surrounding the necrotic area of the brain tissue affected in stroke. So early evaluation and inform everybody that's going to need to be involved. Thrombolytic therapy, I will refer to this as TPA. It does not affect the infarcted necrotic area, but it may help revitalize the penumbra and limit the extent of damage, thus decreasing the effects of the stroke. Thrombolytic therapy is the administration of recombinant tissue plasminogen activator, RT-PA, within 3 hours of the stroke onset. It is important to do a quick CT scan to see if it is a clot or a bleed. TPA is associated with increased risk of reperfusion injury. It is a risk versus benefit. Remember that the first 3 hours, there is a risk of bleeding. So be safe. Be attentive to contraindications. And when are anticoagulants not given? Any patient with a hemorrhagic stroke. Airway protection and oxygenation. We need to prevent aspiration. So position the patient at 30 degrees. Don't feed until it's safe and the patient has established safe swallowing. Airway management, O2 administration, and turning frequently is very important. Again, evaluate swallowing. Suction may need to be used to prevent pneumonias. Again, remember your suctioning skills, only if absolutely necessary. The most common reason for non-neurological related death during the first months post-stroke is pneumonia. Blood pressure control. Avoid wide swings in blood pressure. control crazy blood pressure, but don't bring down too much or it may do more damage. Remember, we need to maintain perfusion without promoting cerebral edema. Avoid stimulus. It raises blood pressure. This can include pain, full bladder, and increased ICP. Initially, some hypertension will be allowed after the stroke, unless TPA is contraindicated if blood pressures are sustained above 185 systolic over 110 diastolic. So TPA is a clot buster given IV, breaking up the clot and allowing the blood flow to return to the deprived area of the brain. Reperfusion injury is an injury to the cells due to the release of oxygen-free radicals that occurs after blood supply has been restored to the ischemic area, and it can present as a conversion to a hemorrhagic stroke. Elevated temperatures have been associated with poor outcomes. The brain is using too much energy. Manage hyperthermia with acetaminophen or cooling blankets. Protect from low glucose. Hypoglycemia can lead to further brain injury, yet hyperglycemia has been associated with poor outcomes. Control of arrhythmia, critical to monitor cardiac rhythms. Manage atrial fibrillation. Remember aspirin, anticoagulation, dipyridamole, and etc. Nurses must be skilled in identifying functions, such as swallowing, that the patients are no longer able to perform, and arrange for further assessment and appropriate management. The nurse must intervene to assist in the restoration of neurological functioning and prevent development of complications. Complications can include all of those associated with immobility, risk for atelectasis, pneumonia, impaired skin integrity, DVT. Stroke patients unfortunately have multiple losses. Holistic care is essential to promote maximal potential. For DVT or possible pulmonary embolus, range of motion, SCDs, medications. For cerebral edema, make sure there's appropriate fluids running and evaluate for headaches and decreased level of consciousness. Manage pain and evaluate for skin breakdown. Reposition the patient often. Unclean, dry skin needs to be maintained. For poor nutrition, increase protein, fluids, and please have patience while the patient feeds. It's going to take them longer. Evaluate for the risk of aspiration. We need to help prevent nosocomial infections, so Foley's or if the patient is on the ventilator. Remember, the patient has deconditioning and injury of the paralyzed limb, so those limbs need to be supported. Thorough assessment of the abilities and limitations is critical. Establish physical activity as soon as the patient's medical condition is stabilized. Include physical, occupational, and speech therapy. Remember, early rehabilitation, that should start day one. Review the following slides, including TIA. Most of the slides are going to discuss changes seen with strokes. Then, in class, we're going to discuss those as well as the nursing interventions appropriate to each defect.